The American Academy of Ophthalmology President, Dr. Bill Rich. Not running for U.S. President. But Dr. Rich is going to share with us pearls. Here you go. For the young
Thank you. Unlike Donald Trump, I can actually read a word processor, but I'm not going to do that. First of all, just for a little history, does the Academy really honor and really dramatically support young ophthalmologists? And the answer is yes. We didn't have a formal program. When I was 32 and I was taking my written boards, there was an act passed, the National Health Planning Act. I walked up to the EVP and I said, "What are you going to do about that?" He said, "Write me a letter." I've been involved since then. All right. And a little bit later on, they involved a lot of other young physicians that were interested mostly on the socioeconomic side. There was always a pathway for young clinical scientists. That was in the early 80s, and one of those docs was a young guy by the name of Richard Lee, who just retired like I'm retiring, and he actually started the YO program. Why? Because there wasn't a formal way. We just kind of made our way. But actually the tradition and the culture of looking to young people for leadership was been there for a long time before, even though there was no formal program. So the YO program's been a real success, and it really is supported by the board and everyone else. At this time, I'll entertain some questions from you. I'll throw one out to you. People say, well, how do you get involved? How do you actually move from a YO position into actually areas of influence and leadership? It's pretty easy. You raise your hand. And you go outside your comfort zone. You all have a niche interest and things like that. You have to expand that niche so that you understand how decisions are made, how people make decisions, how to influence those decisions, and how not to be dogmatic. The only way is to get in there with groups that you don't share the same ideals or concepts with, and many of them outside medicine, whether it's civic, whether it's in your community, your alumni groups. You start really interacting with other people, younger and older, but that's how you learn how to handle yourself and to grow. You know what, when you're 40, sounds like I'm home with my grandkids. I love it. When you're a grandfather, that's a great sound, you know. When you get to be 40, you're all real smart, real bright, and you're accomplished. You'll be much more accomplished. And your comfort level with your profession, it'll be there. Financially, you'll be there. What do you do with another 30 years of practice in front of you? How do you continue to grow intellectually, to do things that are going to stir your pot? And that's when you really have to look beyond your comfort level and your practice, whether it's with the Academy or whatever. And the Academy will give you those opportunities, but you can't stay in the niche where you are now. You got to raise your hand. A classic example is my wife, Janet. She was a cardiologist, raised her family in a small California town. But when she got to be about 38, she raised her hand. Within 5 years, she was on the stem cell board in California, the most prestigious granting operation, still in private practice. That brought her attention and volunteering on different committees, the American College of Cardiology, to a board position in her 40s. And then all of a sudden, after 23 years in practice, she left the small town and became head of science and quality of ACC, 84 employees, $24 million budget, and running 12 registries. So that's what happens, but to actually change, not that you're going to leave practice, but that's an example of you got to raise your hand, do something you're not comfortable with, and other intellectual opportunities, whether you stay in your group or not. But I encourage you, if you don't, I'll guarantee you, you get a little burned out by your late 40s. So Any questions or observations? Hearing none, the meeting is adjourned. No, I'm just kidding. Right now, I'd like to invite some good friends and colleagues, Susan Day and Tamara Fountain, to come up. Susan's going to tell us a little bit about the Artemis Award and our awardee, and Tamara and I are going to be playing Vanna White. How does that sound?
Good morning, everyone. It's so good to be here. It's my privilege, because I am the chair of the Senior Ophthalmologist Committee, to talk with you about awarding a young ophthalmologist. 3 years ago, the Senior Ophthalmologist Committee felt that it was very important to honor one of you for significant work to help those who don't usually receive help easily. Our first 2 Artemis Award winners were those who had been doing international work, missionary work, and shortly I will introduce the 3rd year awardee today. And what is notable is that this will signal work that is done domestically. Why do we call this the Artemis Award? Artemis was the Greek goddess of suffering. I think we have 2 presidential candidates who think that they deserve the award. But in fact, nobody deserves the award more than this year's winner. Paula Newman-Casey is a graduate of the wonderful residency program at the University of Michigan. Since her graduation, she has served the needy people in her community, establishing a diabetes clinic. She does this without monetary compensation, out of the goodness of her heart, juggling all of the issues that each one of you juggles every day, both personal and professional. Paula is here with her vocal delegate, and we need to bring her back in because it's impossible not to have Eva present. So go get Eva. And Paula? Okay. Paula was a budding young physician even before she graduated from high school. She was the camp doctor and would pack Band-Aids and peroxidase and bandages and would bring help to her fellow camp members. And she was an excited scientist in undergraduate when she discovered that mitochondria actually divided. Paula is an extraordinary person. We are very fortunate to have her chair, Paul Lee, here today as well. Paula, why don't you come up here and we'll see what happens when Eva arrives. Before you get the piece of paper, tell the audience what you're doing, why you're doing it, the joys and the difficulties.
Thank you so much for this honor. It's truly an honor to be standing here in front of you as the 3rd Artemis Award winner. The people who came before me just did amazing things. I was very surprised to be chosen for this honor looking at the past recipients. And I just want to thank everyone for this honor. And I also want to tell you a little bit about what we're doing. Oh, don't fall off the stage, yes. Thank you. So, because I think people can do it pretty much anywhere. So we have formed a collaboration with a local free clinic who didn't have any ophthalmic lanes. And there was no ophthalmic subspecialty equipment there. There's also no ENT equipment or derm equipment or plastics equipment. So a bunch of the different departments at the university got together. Sorry, Eva is so loud. And the university allowed us to form a memorandum of understanding where Hope Clinic, which is this free clinic, would rent Kellogg or the other clinics in the university on a Saturday morning for $0 so that we could use our own clinic space, our own equipment, and we could provide subspecialty services for all of the patients that their primary care doctors wanted to refer. So when we set this up, it was really important to us that we weren't just doing screening, that we weren't just saying, hey, you know, I know you have no insurance, and that's why you haven't seen an eye doctor even though you were having trouble. But now that we found that you have glaucoma, we have nothing to do for you. We don't have a way to get you chronic treatment. We don't have a way to get you surgery. We don't have a way for someone to follow you every 2 months and make sure your pressure's okay. So in our clinic, we have a patient financial counselor who comes every time. So that if a patient needs chronic treatment, if a patient needs laser or surgery, then we can sign them up either for expanded Medicaid, for charity care through our university, or for Obamacare if they're eligible. So we make sure to plug patients in. We've also been really lucky. We have a lovely partner in our community, Stadium Optical, who's donated all the glasses. So when we first started this, we were really struggling with how to get glasses for all the people who need it, because as you know, refractive error is the leading cause of visual impairment, both in the US and in the world. And that is, to me, really crazy, because a pair of glasses is cheap, and not being able to see is terrible. So we kept thinking, you know, how are we going to get all these people glasses? We talked to lens crafters. They said, oh, well, you can have 1 pair a month. And the Lions Club said, oh, well, we only do children. And then the med students went trick-or-treating and they brought me these bags and bags and bags of glasses. And I know there's things like Respectacle, which is awesome, but that takes a lot of work to categorize the glasses, and then you're still not sure if the PD is quite right. So we found a partner in our community who just said, you know what, it's not that big of a deal. 20 pairs of glasses a month, whatever, I'll do it. And they're doing it, and they've done it for the last 5 years, and they're continuing to do it. They've donated 350 pairs of glasses and counting. So I think this is a model that anyone could replicate. I have to say it's only been possible at the University of Michigan because of the generosity of all the volunteers. We've had over 150 people volunteer over these past 5 years, so I have to say this is an award I'm accepting on behalf of all the different people in our department who've helped out. So thank you very much.
On behalf of the Senior Ophthalmologist Committee, we do award you the 2016 Artemis Award. Paula, you deserve it. Keep up the good work, and we look forward to nominations of other individuals next year from this wonderful group. Thank you.
Thank you.